Many developing countries face an acute shortage of health workers. Malawi is not an exception. In fact, even by African standards, the health worker-patient ratio in Malawi is very low. It is estimated that only about 5,000 doctors, nurses and midwives serve a population of about 14 million. Because of this severe shortage, some health workers perform duties they are not trained in. This puts up additional chores on them, as well as compromises the quality of health service delivery. The challenge of shortage of staff and lack of training in Malawi is further compounded by the lack of essential equipment and infrastructure in clinics and hospitals. The health sector challenge is even greater in rural health facilities, where the triple problem of shortage of staff, inadequately trained staff, and lack of equipment and essential supplies is most felt. These health facilities also serve huge numbers of patients. VSO Malawi and its partners realise the huge challenges that the health sector in Malawi is facing. The Tropical Health and Education Trust Project, known in short as THET, has been trying to address these challenges since 2012 when it was set up, and the impact that the project has created is evident. The THET project aimed to contribute towards a reduction in maternal mortality in Malawi. This was to be done by improving and developing the skills of health professionals to contribute towards improving the quality of maternal health services and also strengthening other sectors in the health delivery system. Some of the objectives of THET included increasing the number of qualified nurses and midwives graduating from targeted training institutions, improving quality of maternal health care provided by nurses and midwives through enhanced continuous professional development, known as CPD, and improving the deployment and distribution of nurses and midwives through a fully operational integrated human resource information system, known as IRIS. All the objectives have been met. Some of the objectives have been realised thanks to the Partnership Support Fund, a small grant offered by VSO to partner organisations to allow them to meet their objectives. The small grant is offered through VSO volunteers working in those organisations. Some of the projects that the grants have made a reality include the Human Resource Management Information System at the Ministry of Health headquarters in Lilongwe. This system is assisting the Ministry of Health to map out the number of health workers and their skills with ease. Before the setting up of the system, this crucial information was filed in outdated systems made up of paper files. This was cumbersome to access and retrieve information from. Today, at the press of a button on a computer, a Ministry of Health worker at the Ministry headquarters can retrieve or input information about a health worker in Mulanje, Tiolo, or any other part of Malawi. The worker at the headquarters can clearly see how health workers are deployed out in the country or a region of the country, what skills are in what place, and parts of where crucial skills are lacking.
My name is Gillian Kalamba. Yeah, I've been working with the Ministry of Health for about 8 years, and I've been managing IRIS system for about 3 to 5 years. At the moment, IRIS, we are using IRIS to generate reports mainly on staffing list. We are continuing to customize it so that it should continue giving us some of the reports that it was not able to produce, reports like vacancy rates, retirement rates, deployment. We want to still continue using it to give us the focus, how we could be able to improve on our deployment. We cannot forget to mention what VSO has done. When starting from 2012, I should say, we had 6 VSOs who came in to help us to customize the system. There have been some small grants from VSO as well to help us with some of the other issues that we were having problems with. For example, provision of internet in the IRIS office at headquarters, and VSO has also helped us to procure some of the computers in some districts which had odd computers, printers. And since we also have problems with internet, as a stopgap measure, VS also helped us to procure dongles so that maybe for a shorter period people could be able to log in into IRIS and do some updating of the system.
My name is Makifani Magombo. I'm working in the Ministry of Health in this section of human resource, and more specifically in the IRIS. We migrated from HRMIS to IRIS. Then when we were starting IRIS, we had a number of gaps that we were supposed to be filled. We didn't have enough equipment like laptops, like computers. So with the support from VSO and the aid from THET, we were able now to procure laptops, to procure computers. We even had problems in terms of internet. We were able to buy some other gadgets pertaining to internet.
Continued professional development is crucial in development of the capacity of health staff to effectively deliver. This is another area where the PSF support has proved crucial.
I'm Dr. George Talama. I'm a District Medical Officer for Kasungu District Health Office. We have learned a lot of things, ranging from technical issues and even administrative and management issues. Yeah, for example, we've learned on customer care. We've been learning how to handle patients. For example, simple things that our patients care about, like just greeting them. They care about that, and they see that you're caring about them. And the way you speak to patients, they care about it. So we have learned a lot of things in that area of customer care in such a way that our outpatient utilization rate at the moment is more than 100%. Yeah, so outpatient utilization rate is one of the crucial indicators in health service delivery. It shows that you are seeing more patients, yeah, in that catchment population you are in. So it means it also shows that you are caring as an institution. You are caring for the patients. The patients they like your institution.
Through the PSFs, a number of health institutions have benefited from skills laboratories, computers, renovation of structures, books, etc.
My name is Maxwell Bangani. I'm the principal at this college, St. Luke's College of Nursing. This grant helped us to develop a procedure manual which is used by both students and the tutors when teaching in the clinical area. We have also benefited from the IT services through procurement of a photo printer and some computers.
My name is Anthony Matias. I'm a student at St. Luke's College of Nursing. I'm so happy to use these computers, and these computers are assisting us for browsing, for getting information on the network. I mean on the Google. We can search on the Google, and you can see in the Malawi, books are so expensive, so that we are using it as a cheaper one.
I'm Grace Juaro. I'm taking a course of nursing and midwifery technician. I'm happy to use the computer since some information in the books at the library are not found there. But as we are using the computers, we are able to get some books outside the country whereby we can read some information.
The THET project shows that even with all the challenges associated with the health sector in Malawi, there is a ray of hope at the end of the tunnel. Together, we can make a difference.